access to healthcare today is much different than it was 40 years ago. In 1970, Casa de Amistad, a community action group concerned by the lack of medical service available to farm workers and their families, sought aid from the federal government to build a clinic that would meet the needs of these families. After much hard work, this grassroots effort team saw the fruits of their labor. On July 1st, 1970, a government grant was awarded for $375,000 by the Department of Health, Education, and Welfare. However, Casa de Amistad's good deeds and good intentions met with oppositions from some physicians and community leaders opposed to the clinic. The opposition was so great that at one point the clinic was in jeopardy of losing its funding before they could even open their doors. Good eventually prevailed. In October of 1970, an outpatient clinic in Brawley, complete with physicians, nurses, and support staff, opened their doors and became a reality.
It was a great thing for the community. They were very glad, and there were only about 22 employees. And we used to go out actually to get patients, and then we had so many patients, we didn't know what to do.
We have farm workers coming in, local people that live here from all over the country, all over the world.
I think it mattered a lot to him because he had employees. Some of the migrant workers that they had and their families did not have any insurance, and I think that was very important because they had a place to go for health care for their families, their children, and I think that's what it was very important to him because there was somewhere for them to go.
So here's a place built in Brawley, was over there on K Street, built in Brawley, we can take care of and spread the wealth, and we weren't interested in, we want to make and break even, there's where we are, and so that's the way to go. People have to have care.
The clinic was originally named Clinica de Salubridad de Campesinos, and as the name implies, they provided medical care to mostly field workers and their families. The clinic made house calls when needed and remained open late into the evenings and on weekends so that workers could get the medical care they needed without taking precious time away from their job. The little clinic didn't stop there. Urgent care services were available 24 hours a day with just a phone call. As time passed, the clinic began to grow and evolve to serve people from all over the Imperial Valley and from all walks of life. Soon, the name also evolved to what it is known today, Clinicas de Salud del Pueblo, and often referred to as simply Clinicas.
Well, I know a lot of the farm workers worked very early hours, late hours, and I think that the clinic serviced them by, being open early, staying open late, and that way they could go home, pick up their families, take them to the doctors. Because a lot of times the husband went with the spouse, to take them to the doctor, and I think the clinic just helped service their times so that they could get their families in to see the doctors.
Help the people that need it, whether you're got all sorts of money or you're the lowest down person in the world. People have to be cared for. In most cases, they didn't bring it on themselves to get sick, to have diseases, and if there's a place that we can help them, I think we should.
They were very grateful that finally they would get some care and that they could afford.
Throughout the years, Clinica de Salud del Pueblo has served thousands of patients and has provided top-notch medical care. Partnerships with hospitals and other service providers developed, as well as more programs to assist patients in need. With this growth has become new centers for service, and what started in a small convent in Brawley has expanded to 9 healthcare centers in 2 counties, Imperial and East Riverside. Clinicas de Salud del Pueblo serves the cities of El Centro, Calexico, Nyland, Winter Haven, Salton City, Mecca, Coachella, Blythe, and of course, Brawley. Clinicas has 3 WIC, Women, Infants, and Children's programs, and also has 3 dental centers mingled amongst their clinics where they address the dental and oral health needs of their patients. Clinicas has over 15 grant-funded healthcare programs and aggressively looks for new federal and state programs to add to their menu of healthcare services. In Imperial County, Clinicas de Salud del Pueblo is the only federally qualified healthcare center.
I think we're fortunate to have an organization such as the Clinicas Salud. I mean, it's the fact that given the population that we deal with, given the needs that they have, which aren't unique to to the world, but certainly are unique to us here. Having a resource of their type to be able to handle the Medi-Cal patients that we have, the uninsured patients that we have, and the ability to facilitate those patients through the process quickly is important.
Well, Clinicas employs a number of physicians at the 9 sites that we currently have. The role of the physician is actually they are leading the clinical services. We do have nurse practitioners and physician's assistants that work with us, but the physicians, because of the higher level of training, are able to take the lead and set the standard of the care that we're providing.
Everything that we do is based on community need. So I think that's what's kind of unique about federally qualified health centers. It depends on what the needs are of our organization and the communities that we serve.
Clinica's board of directors consists of 15 active members, and Chief Executive Officer Yvonne Bell leads the organization and manages over 340 employees and 41 clinicians. Clinica's staff are highly trained professionals who are culturally and linguistically proficient to meet the needs of their communities. Clínica de Salud del Pueblo's operating budget is in excess of $22 million a year, and in 2009 saw 195,477 patient visits, with 53,256 unduplicated new visits.
And I think there's no doubt but that the health quotient of the Valley would be substantially lower if it weren't for the services provided by Clinicas de Salud.
Well, I'm very proud of our staff, actually. Every one of us, every one of the staff are here because that's where they want to be, from the top down. And I think that really speaks to them, because they believe in the mission, they believe in the patients that they serve, and want to be taking care of them. Some of our staff have been here for years. I mean, this was one of their first jobs, and they've continued to keep on working with us.
I don't know who made that quote, you can't help all the people all the time, but you can help some of the people some of the time. Well, we do a lot of helping some of the people some of the time. And I think that's what the board wants, and that's what the board seems to go, let's take care of these people in the best way we can.
One of the things that I really, really care is helping the patients. Being here for them. We speak the language, most of us do, whereas before they used to go across the border. Now they have the Clinicas, and that's one of the main things I've stayed. I feel that I'm needed to help them out. And I like working for Clinicas.
I enjoy my job. I feel like the physicians, when I go home, I feel good about what I do. I really feel good about the fact that we're providing healthcare services for those that really need it. Our patients are very gracious. They're very, very gracious. And even the community members, local agencies have been very committed to supporting Clinicas. I think initially the history of Clinicas were people didn't want us here. It's a totally different environment now. Clinica collaborates well with public health department, the hospitals, even private practitioners. There's a lot of private doctors in town that work with Clinicas to provide services for our patients that can't seek those services in their offices. So even though they might have a private practice and might not take patients that can't pay, they also are very noble in coming to our clinics and even providing that type of service. So I really feel the full spectrum of healthcare services between our agency and even the private physicians and the local agencies have come a long way from 1970.
Clínicas de Salud del Pueblo has always been dedicated to serving the people. Dignity and respect has been and remains today in the forefront of their mission. No one is turned away or has been denied service based on their ability to pay. Healthcare is ever evolving, and so too is Clínicas de Salud del Pueblo, celebrating 40 years of dignified healthcare with no boundaries.
I think my dad would be very proud. Like all of us in our family are very proud, and I think my dad would be also.